Welcome to Health Watch Oklahoma and Jeff Dismukes. You'll hear his voice in just a second. Starting off with a little different slide, Jeff, this week
Yeah,
with
that's important.
our program on Wednesday night. And I have to tell you, if 2022, when 21 and 2020 said what they said, 2022 said, hold my beer.
Yeah, yeah.
And in the last week, it's just an incredible amount of news since we were here last. We want to start off with this to emphasize what's on this screen. Jeff,
Right.
tell us what we're looking at.
National Suicide Prevention Lifeline, 1-800-273-TALK or 1-800-273-8255. Look, we've been talking about this. This has come up now a couple of weeks in a row. Certainly there's a lot happening right now. There's been a lot of discussion about increases as far as suicide attempts. We've been talking about this for a couple of years, right? And I mean, these are things that have really come to the forefront. We have a number of people who are experiencing behavioral health challenges right now. And I think we started with the pandemic, and we talked a lot about with the pandemic and what's that done. But then you also have issues with the economy. Now we have Ukraine. And that fear and anxiety that goes along with that. You and I had talked earlier this week. We're people who grew up during that Cold War period. So for some of this, it's like it's back. But think also about all the many individuals who have never experienced this before, and all this discussion. And it's amplified now because we have 24/7 news coverage. We're watching it live as it unfolds. People are pushing out information constantly with social media. It's right there. I think before we always had a way to go about our lives and be away from it a little bit, but now it's different. And I think it brings up a lot of questions about what it is that, one, what can we do about this and these added stressors? You can tell everybody's feeling it. What can we do about it? How can we be healthier? But also, is this these increases that we're seeing as far as need? Is it something that is just now, or is it something that's always been there, and we're just maybe recognizing it more right now? I think there are a lot of questions, and our first couple of guests we want to go ahead and start asking them about this and see what their thoughts are. There's also a lot of encouragement, and I do want to get into that about there are more calls for increased behavioral health services, for expansion of the behavioral health workforce. That's all very positive, but I do think we need to get a good picture of what it is that we're seeing right now. And we have with us tonight Dr. Phoebe Tucker, who's a psychiatrist with OU Medicine, and Dr. Peter Kowalski, who's clinical director for North Care. North Care is a behavioral health facility here in Oklahoma City. And thank you both for being here with us tonight. I think I could start off, and actually, Dr. Tucker, let's start with you. And I think the question is, so what is happening right now? What are we experiencing? What are we feeling?
I think I can relate to my private patients who, many of them are quite concerned about the future. So if they have anxiety or depression in the first place, this kind of adds to their issues. And also they've asked about, how do I process this with my children? So, a lot of children are upset about it, not understanding what's going on. So, we try to tell people avoid overexposure to the really graphic scenes. Don't watch TV all day long or social media, and limit the exposure for your children. Sit down with them, process their fears, and then get them to take a break. So, enjoy nature, which is pretty nice today. Get exercise, nutrition, take care of basic needs, be creative. So that's kind of what we tell our patients. It actually reminds me of the Oklahoma City bombing, where people were quite upset, and a much less international event. Of course, 9/11 also stirred up a lot of feelings. But I was looking at this research that was done by the International Committee of the Red Cross in January 2020, and they were looking at 16,000 millennials aged 20 to 35 in 16 countries. And more than half of them said they were afraid there would be a nuclear attack in that decade. So, that was before any of this. So, maybe it relates to North Korea, fears about that, but it's not a new fear. And yes, thank you for talking about the baby boomers, because we kind of went through it with the duck and cover drills.
Right. Yeah, and I think you and I had talked about that a little bit. You were in school in the San Francisco area, and I was in Los Angeles, and that was a regular part of our life then. But and we were kind of conditioned to it, and I think that helped somewhat. But this is new now. There's so many of these people that haven't experienced. But with all of this, so this on top of everything else that's going on, what kind of impact does that really have on us, Dr. Kowalski? I mean, what have you seen as far as through North Care?
So what I am struck with is there's sort of the morbid fascination dilemma when people are watching social media or watching TV. They're frightened, but they're fascinated, and they can't stop watching. And then that generates more anxiety. And in a sense, you build up a state of heightened vigilance. And so this attaches to whatever anxieties and troubles a person might have, and it compounds it. And so one of the patients I saw today, she was born in 1965, described panic attacks at the prospect of entering a nuclear war regarding the Ukraine situation. And coupled with that, we've already been slammed with the COVID situation and current economic problems. So it's fertile ground for catastrophic thinking, distortions, fears, and amplification of already present symptoms.
So, Dr. Tucker, when we look at this, is this something temporary? Are we experiencing something temporary, or is this more? Are we seeing something that's always been there? Are we just now really aware of it? Is this bringing it to the forefront? As far as what do we see in Oklahoma and everywhere else as far as behavioral health issues and how they exist? And I guess I have a follow-up question to that is, so how do we know when it's more than just a temporary type of situation?
I wish we could look ahead and see what's going to happen. And I think that's the uncertainty that we're dealing with right now. So, and I think, with world events, fears of nuclear war or war in general are stirred up every once in a while, but this seems to stir up a lot more than, say, North Korea or I think in Hawaii, there was a false alarm at one point where apparently there was a broadcast that nuclear attack was coming, and it really freaked everyone out. So I think from time to time, there are other events that create this fear. And of course, it's been there with the millennials for a while, and I think the boomers. So, time will tell. I think, we want to have some degree of control over it. So that may be one of the more frustrating things, that we don't have control. We have control over how we respond to it, or maybe doing positive things for others is what we can do at this point.
I'd like
Could I ask
a
question about talking to kids? And it was when Jeff and I started talking about this, and Dr. Tucker and I talked about it yesterday, which was got a Gen Z. And, the old Harry Truman saying, which was, the only thing we don't know is the history we haven't read yet. Right. So this has not been something that's been with us for a very long time. But I can tell by pretty much our panel tonight that most of us are old enough to remember, well, probably not everybody on this panel, but there are people who are old enough to remember when a crazy man parked missiles 90 miles off of Florida, right? And we're old enough to remember some of the saber rattling of the Cold War. We were with that all the time. We saw that all the time. What I saw and heard from people over the last few days is kind of akin as a stressor to what happens usually in May in Oklahoma. Right. I mean, that's one of those, you know, when you hear that siren go off, or when you see David Payne come on and start talking about this is a warning, it's imminent. What Putin did the other day is obviously what he's trying to do is he's trying to scare people. And for the younger generation, that was working. I mean, this is not a scientific survey by any note, but I know a lot of these kids, friends of my kid, and I'm just looking at them. They're all frightened and talking about this until the late hours. What do we say to Gen Zers who've never been through this and who this is affecting their life? People that are just stopping what they're doing, loading up in front of the television. They're consumed by this. How do they cope?
Well, you know, one of the most effective ways I've found to relate and to really get through to anybody, but particularly children, is by telling your own story. You may be inclined to relate times in your life when you've been frightened and when you've experienced a wave of fear and what happened and what you found was helpful to cope for it. The issue is trying to make people feel less isolated, trying to make them feel that people are together, that they're here to support each other, that they understand, at least at some level, what that person is going through. In other words, empathizing. And also providing some instruction that, you know, there's a way out, there's alternatives. We don't have to resort to fight or flight, that we can use our reasoning, we can consider options, that we're not just bereft. We have tools and we have resources that we can draw upon.
You know,
Yes, Peter.
One of the things that's come out of this, I've told or talked about this before, moving to maybe what might be a little more of a positive, since we are having with COVID and all. I think it elevated the discussion around behavioral health in a good way. Not I'm saying anything good. There's anything good about COVID, but if the one thing came out of it, I do think we've talked about it. I think here in the state, we've also, out of necessity, implemented many different ways of delivering services and found innovative ways. We've been able to embrace technology. And then last night in the State of the Union address, the president referenced funding to expand behavioral health services. And what I thought was interesting, and I would like to know more about, is he also referenced clinical positions, the workforce, development of the workforce. These are things that I think we've been talking about for a long time. And so is there any encouragement out of what you're seeing in practice as far as an increased understanding of the need to access behavioral health services, or maybe a lessening of stigma about these services? Or is it just an onslaught of people who are finding themselves in need?
I think over time, stigma has reduced some. I mean, I think there always is some, but it is very heartening to hear the president talk about trying to get mental health coverage for all, and trying to get parity for mental health so that it's reimbursed as well as physical health, so it's covered. And he also mentioned addictions, how important it was to deal with addictions, because many people who are stressed out, use drugs and alcohol. And so, finding treatment for that is extremely important. Reducing the cost of medications. So very, very important psychiatric medications that are not generic, that cost a lot. So bringing the price down, and especially for Medicare.
Go ahead.
I will say that during COVID, we had a vast reduction in the number of people who had access to care out of fear, out of isolation. And as a result, and like as in other areas of medicine, a lot of people's needs went unmet. And with that came with the rebound in severity. And we've seen this in the younger population, where there are higher rates of suicide and suicidal ideation, especially in females. and a greater degree of isolation and a sense of feeling alone. And I think also there's been some misunderstanding about the mechanics of the virus, how it's transmitted, the risks of vaccination, which has caused people to pull back and to question maybe not just vaccination, but other aspects of medical care as well.
So one of the topics that we've discussed quite a bit over the years in my work with the department is that move towards integration of care and more of an integration into the overall medical system and health delivery system. And Dr. Tucker?
Right, I think that's a good idea. So that can reduce stigma when people can go to their primary care physician or their health center and get mental health care as well as physical health care. Mm-hmm. And a lot of times it saves the wait time if somebody's there to help them. So we'll see how that develops, that model.
And Dr. Kowalski, I know that NorthCare has really invested in kind of a change of approach. You might talk just a little bit about that. And I really have a question for both of you because I often get questions about what does treatment look like? And so I do want to get both of you to weigh in on that a little bit so people understand, but talk a little bit about what's available through NorthCare and others like that, other facilities like that.
NorthCare is a comprehensive community behavioral health center, which is a new model of delivering not only specialty care in the form of mental health services, but also providing support for primary care and, in fact, delivering primary care to people who would not otherwise be seeing primary care physicians. In other words, we're sort of, we receive and we refer as the need be to other primary care specialties, for example, variety care, and make referrals to subspecialties. The vast majority of the seriously mental ill, the only doctor that they see is a psychiatrist. And so we're in a position not only to be concerned about brain matters, but about overall health matters and provide a more holistic care that wraps around a person and gets them the services they need. A lot of the mental health, the patients are well, they have a great deal of cardiovascular conditions. They're smoking. They have obesity. They're just simply not getting and receiving the care. And NorthCare strives to integrate that service for the overall health of those patients.
Also, are we talking a little bit more also about wellness? Now, wellness is the word that I like to use, and as somebody who's advocated for services over the year, I believe I've seen a real progression in our understanding of potential outcomes, and what people can do when they're able to access the right kind of services. Is that concept of wellness something that's resonating to where that's the understanding now that we can move to another place? It's not just managed so much anymore. It's about being well and working towards your goals.
Right, because education and prevention is far more effective than proactive treatment or after an injury has occurred. So our aim is to not only try to achieve stability and remission of mental illness, but also to protect and prevent relapses and the other complications such as smoking, obesity, physical activity, diet, and really at the basic level, we're taking on other aspects such as food, housing, getting assistance. Frankly, we're kind of a one stop. What am I trying to say? It serves all. We try to meet as many needs as we can for our clients.
Dr. Tucker, is what's in or are you encouraged? I think is really the question as far as with the progress we've made. are we moving fast enough? Are we moving at the right pace? But also, where do you see us needing to go as far as what are the needs to further advance behavioral health?
Well, it sounds like we need more of what Dr. Kowalski's program offers. So, and I hope that's coming. Obviously we need funding for that, and we need qualified people to provide that care. So, at different levels of care. So, wellness. I'm really glad you mentioned all the lifestyle choices that we want to help people make to keep their health and their mental health. So, I think self-actualization is another thing. So, we improve health and then we try to move them up towards, so what are your life goals? What are you moving toward? And I think that's important. When you mentioned wellness, it made me think of the physician wellness programs that everybody has now since the hospitals, not just physicians, but healthcare workers. So, people were hard hit during the pandemic. And, very hard to give bad news to patients' families or take care of dying people. So I'm really glad that there have been, we've taken care of the healthcare workers as well, the providers. So.
Yeah, and I think that's a good thing just to emphasize with people and you guys. I've realized in doing a project with providers lately and asking them to fill out some paperwork. Which I thought, well, you take time to fill out paperwork, but in talking when I call, I'm hearing things like we have half our staff out with COVID. We start talking about kind of the situation, and really, I think it comes from a lot of what's happening with us environmentally, and where we have people being not polite, I guess is maybe a nice way of saying it, but push back on these workers. And then as someone who is married to a healthcare professional, I know from watching her over the years, you tend to put your own personal needs behind, and you're very focused on the job in front of you and taking care of the people that you're supposed to take care of. Just quickly, what are you seeing as far as within the workforce? Are we seeing people leaving the workforce? Is that a challenge? Are we seeing the medical professionals taking care of their own personal needs?
Well, we'd like to think that they are taking care of their personal needs. There are a lot of things to consider, including some of the stressors, electronic medical records, administrative burdens that they have to deal with, in addition to the tasks that are difficult. So we want to make sure that administration helps them with a lot of these additional things. And I have to say, Dr. Kowalski is training our medical students, and I think the residents to come. And we are so glad that he's doing that, because he's providing that model to them, and the modeling of not stigmatizing mental illness early. So he's shaping their opinions when it really counts. So we really.
I believe that Dr. Tucker has spearheaded awareness of mental health, not only in the state, but actually around the country through her writing and through her leadership. And I think the country I think I'm very appreciative of her leadership, and she's made a mark. And I do appreciate that greatly. We are trying to increase the number of mental health providers, not just psychiatrists. Psychiatrists are actually increasing. Dr. Tucker could maybe speak to this. The number of applications for residency training in psychiatry are increasing, and yet there's still an unmet need, because population is aging, health problems are increasing. We're relying on more of a team model where the psychiatrist physician may be at the pyramid at the top to direct team care and distribution of care. We're using that model here at North Care, and I feel we've had a very good system running, and that we've been able to increase the number of people that we're seeing. And yet we'll never be out of a job. Let's face it, we're going to always need to provide care and try, if we can, to get people interested in the field, become fascinated with it, and find it as a calling, because that's what it really is.
No, I think that's really a good point with that's what I've learned over the years, and being around dedicated professionals. It really is a calling, and I'm hoping that more people will move into this field, especially for young doctors coming in. This, to me, this is the place in medicine. If you want to really be on the cutting edge and where you're going to be able to really make a difference, and with the new treatment options that are coming in and everything else, this is really a place to be, and it's an exciting place to be. And I'm certainly very appreciative of both of you, and very aware of what you've done and what you are doing for the state. And I hope that we can bring a little more attention to this, so that people are more willing to reach out and find that help before they reach that crisis point, and to really work on wellness. I think there's so much that we can do as we integrate this system and start talking about prevention and treatment and recovery all together.
Absolutely. It's only a phone call away. And really, it's serious. That's serious enough that if you're thinking of seeking mental health care, you need to do it. If it's in your mind, if it's in your thoughts, that's a sign that you need to do it. Don't let it get out of hand.
Good advice.
Well, Dr. Tucker and Dr. Kowalski, thanks for such short notice too. I mean, sometimes we know a week ahead what we're going to talk about, and then Jeff and I started talking mushroom clouds when we started hearing from young people who hadn't been around this before. And so anyway, really appreciate your insights. It's a worrisome time. I thought we had this behind us, but we don't. So
thank you for having us on.
Thank you both.
Yes, thank you.
Thank you.
All right. So you're watching Health Watch Oklahoma, moving into the second hour. We're glad you're with us. Can I throw up a couple of questions, Jeff? A couple of statements
absolutely.
from some friends. So this lady is one of the best child advocates the state of Oklahoma has ever known. And Maria Rosales Lambert, who has been a friend for, she was 12 when we met. Just kidding. We've not known each other that long. And she has a Joey, just like I've got a Joey, and she does forensic interviews for young people around the state of Oklahoma. She's a wonderful person. Hi, Maria. Thanks for watching. Here's what she said. There would never be enough mental health and drug addiction services to keep up with the demand. Our state now is working on making marijuana recreational. Be interesting to see how much worse our state is going to be in 10 years. Many more people will be addicted to worse drugs. And thanks for that, Maria. It's been one of those things that's been kind of cultural, and we went full blown medical marijuana and all the problems from a policy standpoint it's created. But I know that folks up in Denver are one of the first health departments that I met where they had kind of semi regulated this, made it recreational. They're starting to see a lot of problems, but Jeff, doesn't get much press. I suppose it does in the academics where they're studying some of the problems there. But you know how it used to, if you made any sort of discussion there might be something wrong with cannabis, then you kind of get hooted and laughed at, right?
Right.
So, but there are people and professionals like Maria who are going, okay, really concerned about what we're seeing.
Yeah, and I hope that we'll listen to the professionals that are out there and that are talking about this. Obviously, there is a lot of movement with trying to just get a handle on the different things that are happening around the state. It's important to when we just had two great physicians on who've been very involved in this field, the behavioral health field. It's good to bring in their thoughts and opinions on this and listen and see what we can do. I do think now, I hope also with her question, we'll never have enough services. I think we have to continue working to make sure that we expand those services and have those services out there. But I definitely understand what she's talking about and the concern on it. Addiction issues, substance use issues, we've been talking about this for as long as I can remember in Oklahoma. I started my work coming out of college working with drinking and driving issues and public safety issues around alcohol and other drugs, and spent many years working on these issues. It is not something that has gone away. We need to understand that this is in front of us, and I can keep investing in the the services to address it, we're going to have a healthier and happier state. We're going to have a more productive state, and we're going to have a workforce that is able to move us forward economically. All this, to me, intertwines. Everything when we talk about health, we'll talk about health here and education here, and in different components in their own space, but really it's all intertwined, and we talk about that a lot with mental health issues. You can't have a decent education if you don't have a healthy brain. We have to work with all these different things and make them work together and build the state.
Okay, ready for our second half hour?
Yeah,
What
absolutely.
do you already have on deck, Mr. Disney?
So who we have joining us is Linda Gargan, Executive Director of the National Federation of Families, Joni Bruce, Executive Director of the Oklahoma Family Network, and Becky Odell, Executive Director of Parents Helping Parents. I appreciate you all being with us. And you were backstage a little bit, so you heard some of that discussion that was going on. These are people, Dr. Gargan, I met her for the first time on the phone this week, and seeing her tonight. Becky and Joni I've known forever, and have worked with forever. Well, it seems like forever, I think, but in a good way. It seems like forever in a good way. But we have a lot of discussion. So we're talking about the impact of just kind of the environment, everything going on right now, impact on children, a lot of things happening out there, and it's certainly a stressor with families. And I think Joni and Becky, you'll be real familiar with these stories. I spend a lot of time working with families from around the state. It's not within the last several months, actually, it's not uncommon for me to get a call about children that were in emergency rooms and not able to find services, or families that have gone somewhere for treatment only to have a child come back into the community and without a link to services locally. So obviously is a situation that becomes negative and often is a repeating cycle. Talk a little bit. I know that we've talked about this, but I'd like you to talk a little bit and share some of the things that you're hearing from families. And Joni, why don't we start with you?
Okay.
And just kind of, what is it? What are families calling? What are you hearing when families are calling you?
A number of the families that, if they can find a therapist for their child, they typically have not been able to access the level of service support that they would like. So if they were hoping to see a therapist once a week, which is very traditional therapy, would be attending once a week, they're lucky if they can get in once a month. And even people who've been in treatment for some time are seeing that their services are being reduced because there simply are not enough therapists to be seen. And for those who don't have a therapist that they've seen in the past, trying to identify a new therapist is even more difficult. There are waiting lists, and we see it in our urban centers, but in the rural communities, if they can find a therapist, they're often having to travel long distances in order to be able to find them. And then that can be difficult for families. You talked about parity a little earlier. I think Dr. Tucker did. Mm-hmm. And, if you have private insurance, you may be paying $50 or $75 every time you see a therapist. If you're seeing them once a week. And then if your child sees a psychiatrist, you have another copay for that. And then certainly the medications are not cheap. So even if people really want to seek treatment, if they can find it timely, the expense of it is terribly expensive. And that's the case both for mental health and substance abuse services. It goes across both, and it's kids and adults. It's just very difficult. So we're hearing that a lot. And then, our hope is that kids can and adults can be served in their community so that they're not having to go to a really long ways from their home, because it gets really old trying to travel long distance. And if you have other children, they want activities and that sort of thing. And so it can cause some issues even between siblings, because one sibling may miss out on a lot because another needs to drive a distance to go to treatment. So it's very hard. We hear that. And then in the unfortunate times when youth do need to go inpatient or to residential treatment, the transition home, schools sometimes don't even know that children have been inpatient. And then here they come back and they're on medications, and, the staff at the school are unaware, or they don't know what the child's triggers are and that kind of thing. So we're setting them up to not have just the best outcomes just because the communication's a little difficult.
Yeah, and I would encourage everybody, and we're going to talk about coming weeks, but there are many different partnerships that are developing right now between community behavioral health providers and the schools. And the schools are incredible partners and having a real ability to identify things early and help link to treatment. So I do think we want to bring that up in future weeks and go a little bit in depth with that. But Becky, is kind of what Joni's talking about. Is that the same thing that you're seeing with the families that you're engaged with?
Oh, yes. And through COVID and everything else, our families have to deal with a child that may have moved back home, or a child that is during the worst part of COVID, your child may leave home and go out and wander around and bring COVID back with them. So we've seen that, and we're past this. But another interesting thing that affected our folks, when the stimulus checks went out, we might have somebody in recovery, a child in recovery, and they get, they're old enough to get a stimulus check, and they're gone. They're gone. So that happened as well. So yeah, it's a really stressful time for parents. They worry about their child anyway, and worry about if they're going to see their child again when they walk out the door, when they're struggling with addiction. But yes, this has made it a lot harder to cope.
So Dr. Gargan, what we're talking about here and what we're seeing in Oklahoma, is this something that's unique to Oklahoma, or is this something that we're seeing nationally?
Jeff, I wish I could say it's unique to Oklahoma, but unfortunately it is sort of the state of the nation right now. We get calls from parents on a regular basis. They are desperate for services. Their children have been stuck in an ED for a couple of weeks, in a bed in the hallway. And it's not because the hospital doesn't want to serve them. It's simply because they don't have the room or the staff to serve them. So we're seeing this, and Joni mentioned siblings. This is so important to remember. This is a family issue. And if one child is affected, the entire family is affected. So we're seeing families that were very stable and intact at one point beginning to show signs of some cracks in that surface. And then for our families that are more fragile, this has just been an unbelievably challenging time for families who are already struggling either financially or relationally. They have had an extremely difficult time.
I was talking to a friend today, and he was talking about her son, and we were trying to figure out a couple of different avenues to get him to the right care. And what I really heard from her is what it really boiled down to. And she's saying that I'm talking to providers and I'm telling them this, and then I'm going to the next group and I'm repeating my story, and then going to the next and repeating. And it doesn't seem like anybody's listening. She's just not being heard as she's trying to share this information. And it's frustration builds to a point where she's continuing to battle. But it's having an impact on the rest of her family. It's having an impact on her. She's trying to be caregiver and treatment finder and everything that she needs to be for her family. And everyone within the family is impacted by this. So what is it? I mean, Joni, is that what you're seeing also about families as far as not being heard? What are they saying? What's the problem? And then I think we come back and how do we do something about it?
Boy, that's the question. This is huge. One of the things that we do at our network is we really promote what we call family and professional partnerships. And the youth needs to be in the middle of that, and especially in the area of behavioral health services. You know, if the child doesn't want to be there, it's probably not going to be effective therapy. And if we as parents aren't actively engaging in the support that our children are being provided, it's not going to be as effective. You know, it's really a triad where you have your providers, and there may be multiple providers. You may have a psychiatrist, and then you may have a therapist. The primary care provider may be managing some health, you know, general health issues that are maybe causing some of the concerns that they have. But if the family doesn't feel heard from any of those providers, and this can happen especially once a child turns 18 and becomes an adult, pretty much the families doesn't have a whole lot of, unless there's a guardianship in place, which typically is not the case. It's pretty much, if the child doesn't want the family to be a part of their treatment plan or their treatment team, then they can't be. And that gets really complicated. But even in cases where the kids are under 18 or they agree to have the family involved, oftentimes families feel like that their voices aren't being heard, you know, because sometimes individuals don't tell the whole story, or their perspective of the story may be very different than the people that are living with them. I know we hear that very often, where a young person may not realize how sick they really are and can say exactly what they need to say to either stay out of an inpatient or to get out of an inpatient situation. You know, they know what to say to get out, but then they get out and, you know, if anything, they're angry with the parent, you know, because they played a role in helping them get that treatment. So, you know, if the people that are being served and their families aren't feeling heard, then the services absolutely are not going to be as effective as if you really see that as a team where you have the providers, the youth, and the parent.
Right. Becky, we've talked about this a lot, and I've talked to many of the families at the different parents helping parents events, and they've kind of they echo this, but those support services are there, not just with you, but also with the Oklahoma Family Network, as far as families can call and engage and talk to other families. What's the positive aspect of them being able to maybe help navigate by talking to others who have been there?
It's just so wonderful for them to be able to talk to somebody else that's going through that. I always refer anybody that calls me, I say, would you like to talk to a parent? And every time they say, yes, I would like to. Because that's kind of the first step to get them in the door and really do some self-help and help themselves and their family. So, yeah, being able to talk to others that are going through that is just really, really important. And then making them aware. We really try to educate our parents, making them aware that, how I like the piece you just talked about, because sometimes they're not thinking. They're in such a mess. They're not thinking about that child that's over in the corner just trying to be good and trying not to make any noise. And that child is really being effective. And I love that we're beginning to go into the schools and educate on that end and educate on the parent side. Because a kid, if people don't realize what's going on with that kid at home or can't recognize that child's going to struggle all his life. I mean, it never goes away when they have to deal with that in the home. So educating even those parents that are struggling with addiction on what's going on and what this is doing to their children, I think is a big part of that. So yeah, it's so great and what we do the most is put parent with parents so they can share the things that they've learned, share the resources that they have. And yeah.
Dr. Gargan, I'm messing up your name all night. I'm sorry. I knew I would do that. I have this fixation whenever I'm seeing things.
Linda is fine.
Talk about a little bit. What's what are some positives that we have in front of us? You and I had mentioned something about the state of the state and what that involved and the issues around calling for additional resources for behavioral health services, which obviously we all agree are needed. But talk to us a little bit about what's encouraging moving forward.
Well, I think the first thing that's encouraging is families and children are very resilient, um, even with all that's happened. And I think we found out that we as a nation are very resilient. So, we don't want to lose that in all of these conversations. It's very important to think about that and build from that. I think another thing that obviously just happened last night was we heard our president talk about mental health, which is the first time we were all trying to remember today the last time we heard mental health mentioned in the State of the Union address. We believe it was when Kennedy was president, but none of us really remember Kennedy quite that well. So we think that's when it was. But we heard this administration speak about mental health, and they had really set a focus on mental health. So yesterday and today, I've spent my entire time with White House staff, with staff out of Secretary Becerra's office, talking about how we're going to move this forward, because we're so excited about this new opportunity. Now, we know it's not going to happen quickly. We heard the president speak about expanding our workforce, and we know we need that, but we know we cannot do that today or tomorrow. So we've got to be thinking long-term and short-term, because we have children and families who have needs today. One of the things that we also do, and Johnny and Becky have sort of talked about this, and I want to put a name to it. We have family peer specialists across the country. They're called different things, different places, but these are parents who have already walked this walk and navigated these systems. And they've stepped up in our various agencies to walk side by side with other parents to help them with their journey. And I truly believe that's one of the most positive things we have brought to the workforce in quite a long time. And it's also helping to fill in where we do not have the staff we need, who are clinicians and therapists, where we are short staffed. We have peers to come into that workforce. They do not take the place of therapists, but they work alongside of them and really enhance that work. So we're extremely pleased about that.
I want to, before we do any start wrapping here, I want to make sure we talk about another event that's coming to Oklahoma this year. Your organization is putting on a national event, a conference. I think that's important and a great thing to really promote here.
Jeff, we're so excited. Some of the friendliest people, best people we've ever met are in Oklahoma. Wow. And they have been lobbying us to bring our conference there for several years. And we finally were able to work it all out. So we will be in Oklahoma in November. Our conference is a wonderful blend of families and professionals and researchers all coming together on behalf of families and their children. So, for anyone in your listening area, I would certainly encourage them to consider joining us. It should be an incredible event. And it's going to be so nice to be able to do this face-to-face this year instead of online. So we are very excited to be there.
So I want to also say I'm encouraged with this happening. This is a great state to be coming to do this right now with all the work that's going on. Our elected officials have actually embraced these issues, and I'm excited about the opportunity that we have moving forward. And it's a bipartisan issue, really, in this state. I think more and more people have become aware of just how important behavioral health services are, behavioral health services for children. They understand the frustrations that families are experiencing, and frankly, the discrimination that's going on as far as how we approach treatment to behavioral health issues, and they're doing something about it. And I'm encouraged as we go forward. I think we're in a good time with all the bad that's happening. I really think we're in a good time for the state to really make some progress. And I hopefully there is hope out there, and I believe that the different things that are happening. I know Joni's involved in a project right now that I know about, where we're looking at health equity issues and trying to raise the voice of populations that have been underserved. and underrepresented. So as we tackle some of these new things, I again have great hope that we're going to be able to make some incredible progress in the years to come. But it is going to be about expanding those services, overcoming those barriers that exist. Joni and Becky, as we kind of wrap up here, I want to make sure also people know how to reach your organization. So Joni, you want to talk first a little bit about Oklahoma Family Network and
Sure.
talk about what you do.
Sure, I'd love to. Oklahoma Family Network, we provide parent-to-parent support for families that are raising children, youth, and young adults with special healthcare needs and disabilities. We're also one of the state chapters for the Federation of Families. And basically what that means is if you call our office or go to our website, which is oklahomafamilynetwork.org, our office number is 405-271-5072. And if you call that number, you will always get a hold of a parent who has a child with a special need. And a lot of our staff do have children with behavioral health needs. And we'll connect you to resources, help you fill out applications. If you have an application you can't seem to get through an agency, or you can't get in with a therapist or that kind of thing, we'll try to help you navigate those waters and help you find other resources. One thing I do want to say is we mentioned the difficulty of finding therapists, but don't give up. Call places like Parents Helping Parents and Oklahoma Family Network. We will help you find someone to see you or your child. We will not let it go until we do. So don't give up. Please call. We are more than glad to help. We're more than glad to connect you to whatever resources that you need. And we have staff kind of sprinkled across the state. And so they know the resources in the different regions of the state. We also do training. And then we have a Family Professional Partnerships Conference that'll be held on March the 25th. And we'd love to have anyone attend that. And again, if you look at our Facebook page, which is Oklahoma Family Network, you'll find that. And Jeff, I don't want to forget, I know we have to hurry, but My Mind Matters Day at the Capitol for behavioral health is on April the 21st. And we'll all have tables with resources there at 10 a.m. in the morning. And then the program will begin at 11 a.m. So I hope everyone will plan to attend that as well. It's just a great awareness. I was at the Capitol today, and everyone I talked to, every legislator that I spoke with was glad to stop and talk to me because we were talking about behavioral health. They're all very acutely aware of the needs. Yeah, and I'm very thankful for that.
That's really encouraging, and frankly, I don't know that that's happening in every state. So we're very fortunate to have elected officials who are so supportive. Becky, how do people reach Parents Helping Parents?
Well, they can go to our website at parentshelpingparents.info, and they'll find tons of resources there, and they'll also see when our meetings are held. Of course, we're doing those online right now. We also have a live virtual chapter every other Monday night, and they can check the times for those. And so we're providing lots of meetings, and they can the phone number, they can call 405-550-7326, and we can put them in touch with a parent or put them in touch with another resource with it where they can connect with a parent. Partnership to End Addiction will work with parents for 6 weeks to help them get through some of the problems with their kids. We also, right now, we're in the middle of our first conference on the children's behavioral health side called Renew You, strictly just related to substance use disorder. And we just kicked that off last week. We had our second person this week, and we're just bringing on some folks who can help people understand addiction and give them some ideas. We talked about trauma at the last one. So you can go to our Facebook page, Parents Helping Parents, Inc., and you can register for any of those. We were really tickled because we had over 300 register for this. It's our first one, so that's really great.
That's fantastic.
Yeah. So, and we're doing a lot of things too. We're also offering in March a training it's called Train the Trainer. And we're doing that through Partnership to End Addiction. They're providing training for our parents who want to learn how to facilitate and to teach other people how to do parent workshops across the state. So we're really excited about those things. We're busy.
Linda, do you have a website so people can learn more about National Federation of Families?
Absolutely. Our website is ffcebh.org. And you can learn more about what the Federation does. You can learn about our National Family Support Technical Assistance Center. It's the first one SAMHSA has ever funded. We have so many things going on for families. We would love to encourage folks to get involved and join us in these efforts.
So, Scott, I saw we had a couple of questions that popped up. I wondered if we could close out and maybe address one or two of those. And this is Carla had emailed. Scott popped it up, and I'm going to have to read it, and that's difficult for me, Scott, because I didn't have my reading glasses. But Carla wrote, Jeff, that is the big problem. Families are not being heard. Frankly, it's starting with lack of quality of care for mental health crisis. 72 hours is not long enough to evaluate if the participant will not cooperate with the eval. They are just released. I have guardianship of a very ill adult, and the whole system is ignoring guardianship. It should be a higher burden than not suicidal or homicidal in order to be stable. And I've heard things like this from people, and I've definitely fielded calls. And again, I think I would reference back also to what Joni was saying. Don't give up. There are a lot of barriers in this process for all of us when we go through the system, and it's a matter of continuing to try to find the means in, and not losing hope. But also, I would say also that it's also about coming back and working with these types of organizations who can help advocate, can help make it through that system. And of course, everybody can call us at the Department of Mental Health. If you're in our system and you're experiencing problems, and we're able to make a phone call quickly. If you're outside, guess what? We'll still make a phone call and help navigate people through this. And that's what we want to do. So I want to make sure people understand that we're a resource. But before we close, anybody have anything that they want to say back to Carla also from that question, as far as hope and encouragement?
Well, I think it's just what I said earlier, don't give up hope and reach out to the family organizations, because oftentimes we can connect them to people that can be really helpful. And sometimes that is calling the Department of Mental Health and Substance Abuse Services so that you guys can get involved as well. And I highly encourage people, talk to your legislators. Sometimes it's a matter of the buck. It takes more money, and if you don't have enough providers, then, we have to grow them. And people need to be able to afford to go to college in order to be these types of professionals. It's not free to go to school. And so there's probably a lot of answers to how we increase the number of providers in this area. But don't give up. Call Parents Helping Parents, call Oklahoma Family Network. And if we don't know the answer, we'll help you look for it.
I think these are the groups that have built behavioral health over the years. These are the people that have been working to change the system, and it's changing for the better. Progress is coming a little slower than some of us want, but we are moving in a positive direction. And I believe as we get more and more people behind this, then we'll see those changes happening more rapidly. And these are definitely things that we all need to be working on. But I appreciate all of you for joining us tonight and taking out your time, especially Linda, who's on the East Coast, and it's even later for her. It's past my bedtime already, so you can only imagine what you're experiencing right now. But thank you so much. It's important that we discuss this, and hopefully we can continue to maybe help link people to the resources that they need to find answers for their families.
Absolutely.
Thank you all. All right, Mr. Dismukes, let's end by throwing this slide back up. By the way, thanks to all of our folks who wrote in tonight and to our panelists. So leave you with this. Jeff, narrate away.
Hey, National Suicide Prevention Lifeline. This is a 24/7 line. You can call. There's a caring professional on the other end. There's also prompts on there if a veteran calls in to speak with someone who is very educated around veterans issues. You'll be talking to a peer and can provide you help. They're a group that can listen, and they can link you to services here in Oklahoma and in your community when you call. And I just really want to encourage everybody to understand that we're all going through different things right now. We never know exactly what's happening in a person's life, what they might be experiencing. Try to remember to have compassion for others, and understand that you might be the only person that someone's interacting with, and you might be the only one who has an opportunity to let them know that somebody cares and ask them if they're okay. It's important, I think, right now that we all support one another. There's too much going on. Let's try to help each other be well, and let's move our state forward.
All right, to all of our panelists tonight, we'll say good night to you and to all the folks who are in panel number one. We really appreciate it. And there's a lot right now, as Jeff just said, happening. And we'll leave this up for a moment. But for all you folks out there that are working to help people maintain in some really tough times, we salute you. So for Jeff Dismukes, Scott Mitchell, all the folks, thanks to all the folks at News 9 News on 6 on all their platforms on Facebook and Twitter. We'll leave you with this right now. Have a good night, everyone.